only on DD National.
वाह क्या टेस्ट है, प्रतिदिन दोपहर 12 बजे।
Half an hour will get you all the news related to COVID-19 and of course the cases and the way forward. But first, let's take a look at the top stories. The centre issues guidelines to states and union territories for interstate movement of stranded persons. States asked to develop protocols for receiving and sending the stranded migrants, pilgrims, tourists, students and others. The states need to agree on movement by road subject to certain conditions. The Home Affairs Ministry holds a comprehensive review meeting on the lockdown situation, says restrictions should be strictly followed up to the 3rd of May to ensure that the gains are not squandered away. New guidelines easing relaxations in several districts to come into effect from the 4th of May. Agricultural operations overcome lockdown odds. The Kharif sowing increases by 38% this year. The offtake of the fertilizers and the seeds higher than the last year. The government estimates 3% agricultural growth rate amid expectations of a normal monsoon. The COVID-19 transmission rate declines in India. The doubling rate is now at 11.3 days in the last few days. The mortality rate in India is 3% compared to global mortality rate of 7%. The active COVID-19 cases in India reached 23,651. The death toll stands at 1,074, while 8,324 patients have recovered. The government urges all its officers, employees and outsourced staff to download the Arogya Setu mobile app to break the chain of transmission. The global tally of confirmed COVID-19 cases goes past 31 lakh with over 2,27,000 deaths. The US is the worst hit with over 60,000 deaths, followed by Italy, Spain and France. The US says the drug remdesivir is showing clear-cut positive results in diminishing the time to recovery. Japanese Prime Minister says it's impossible to hold Olympic Games unless the COVID-19 pandemic is contained. And at the top of the show, let's first take stock of the developments in India, Ground Zero. Now, as per the latest updated data provided by the Health Ministry, the active cases of COVID-19 in India stand at 23,651, while 1,074 deaths have also been reported from across the country. 8,324 patients have got cured and discharged. The COVID-19 transmission rate has declined in India. The doubling rate is now at 11.3 days in the last few days. The mortality rate in India is 3% compared to the global mortality rate of 7%. And let's now take a look at the 5 worst affected states in the COVID outbreak in the country. And if we can have that video wall up for you, in fact, the total confirmed cases and the cured cases and the death toll as well. Let's first begin with Maharashtra. In fact, we'll be trying to illustrate that to you through the use of a video wall here. If we can have that up as soon as possible. There we have it, the map there. Of course, Maharashtra there leading with confirmed 9,915 confirmed cases, of which 7,890 are active, 1,593 have recovered and 432 have lost their lives. This is as far as the toll in Maharashtra is concerned. Maharashtra, remember, remains the worst affected state in India. Next up, we have Gujarat, where the confirmed cases stands at 4,082, out of which 3,358 are active, 527 have recovered and 197 have lost their lives. Gujarat remains the second worst affected state in India. Third, of course, is the national capital, Delhi. If you can have that up on our screens as well. There we have it. Confirmed cases 3,439, active 2,291, recovered 1,092, and 56 is the death toll that Delhi is witnessing as we speak right now. Fourth is Madhya Pradesh, of course, which 2,561 confirmed cases, 1,971 are active, 461 have recovered, and 129 have lost their lives in Madhya Pradesh. And of course, the last one here, Rajasthan, confirmed cases 2,438, of which 1,619 are active cases, 768 have recovered, and 51 is the death toll that Rajasthan has witnessed so far. Of course, you are seeing that on the map as well, which is being reflected by the state that we're talking about there. Clearly, the orange zone and the red zones as well. So there we have the entire tally as far as confirmed cases are concerned. Confirmed cases stands at 33,050, of which active are also 23,651, recovered 8,325, and those who have lost their lives now stands at 1,074. Of course, these are of course the different zones that have also been reflected in this video wall. This is of course the data, the latest data provided by the Health Ministry that is being reflected in this video wall as far as the total number of COVID-19 cases across the country is concerned. All right, and moving on now, the migrant workers, tourists, students and other people stranded in different parts of the country due to the ongoing lockdown were on Wednesday allowed to move to their respective destinations with certain conditions, giving a big relief to the distressed people. In an order issued to all the states and the union territories, the Union Home Secretary said that the buses shall be used for transport of such groups as stranded people, and these vehicles will be sanitized and will have to follow the safe social distancing norms in seating. The order comes into immediate effect. And listing the conditions, the ministry said that all the states and the union territories should designate the nodal authorities and develop standard protocols for receiving and sending such stranded persons. The nodal authorities shall also register the stranded persons within their states and union territories, and the moving persons would be screened, and those found asymptomatic would be allowed to proceed according to the Home Ministry. On arrival at their destination, they would be assessed by the local health authorities and kept in home quarantine unless the assessment requires keeping them in an institutional quarantine. And all those people who avail the opportunity will be encouraged to use the Arogya Setu app, through which their health status can be monitored and tracked. In more news now, the Home Affairs Ministry has released new guidelines to fight COVID-19, and they will come into effect from the 4th of May. Now, these guidelines shall give considerable relaxations to many districts. According to the Home Affairs Ministry, the details regarding this shall be communicated in the days to come. The Ministry for Home Affairs held a comprehensive review meeting on the lockdown situation on Wednesday. Now, there's been tremendous gains and improvement in the situation due to lockdown till now. And to ensure that these gains are not squandered away, the Home Affairs Ministry has said that the lockdown guidelines should be strictly observed till the 3rd of May. And the centre has also asked all its officers and staff working with the central government to download the Arogya Setu app. The Ministry of Personnel, Public Grievances and Pensions issued a memorandum stating that Arogya Setu app is mandatory for the government officers. In fact, all the officers, staff, including the outsourced staff as well, working in the central government should download the Arogya Setu app on their phones. The officers and the staff should review their status on the app before starting for office and commute only when the app shows safe or low risk status. If the app shows that the person in the moderate or high risk zones, they should not go to office and self-isolate for 14 days or till the status becomes safe or low risk. The Joint Secretary of the Administration shall ensure strict compliance to this. Similar instructions shall also be issued to all autonomous and statutory bodies and the PSUs attached to various ministries. Now, the Department of Science and Technology and its various autonomous institutions have made some significant efforts to address research and development and innovation challenges arising from the COVID-19 pandemic. Our correspondent Tapash Bhattacharya spoke with the Professor Ashutosh Sharma, the Secretary, Department of Science and Technology. Listen in.
Joining me right now is Professor Ashutosh Sharma, who is the Secretary of Department of Science and Technology, and to talk on more on the COVID-19 situation in India.
DST also does, for example, looking at the future needs in terms of science and technology. I'll just give you two examples, one of which could be redeployed in the case of COVID activities. So this example is cyber physical systems, on which we launched a nationwide mission last year, and already 18 hubs related to artificial intelligence, machine learning, robotics, Industry 4.0, and so on have been established in IITs. And we asked them, look, what are the solutions that you could provide for COVID? And this work has started already. Very good quality scientists have started working on it. Take, for example, the problem of rapid diagnostics. So by looking at the chest X-ray and training a machine in artificial intelligence, you can make very accurate diagnosis of the virus. So this is an example. Modeling, simulation, predicting the future are some of the activities which have been taken up by this group. I'll give you another example wherein we had established a project in Sri Chitra Institute of Medical Science and Technology in Thiruvananthapuram. First, we established a center there for technology development 4 years ago at a cost of 100 crores. And then they started developing this platform for rapid detection of TB. Now that platform and the people who had deep knowledge of it could repurpose themselves very quickly to look at the detection of coronavirus. And this is actually a breakthrough. It's a global breakthrough, not just for India, but for the world. So for example, this LAMP platform could do the diagnosis of a virus in about 10 minutes as compared to 2.5 hours for PCR-based systems, and that the machine itself would cost about 1/10 of what a PCR machine cost. So for doing the test in speed and scale, this would become possible. You could test something like 1,000 tests a day with a single machine. So the reason I'm saying this is that basically all the infrastructure which was there, the people with very deep knowledge which is there, so our capacity and capability everywhere, whether it is in startups, whether it is in industry, all of that could be leveraged very quickly.
How long do you think that this diagnostic kit, which is very important in current scenario where we have to do testing, for a large number of people, how long will it take to come in the market and get approved?
Yes, so it's on the way to approval by ICMR. All the tests have been done. So now they have already tied up with a couple of companies. The talks are progressing very well with one of the big companies which may have global reach. So my sense is that by end of May, we may have first 100 machines. So it's just another 1 month. 100 machines, don't forget, 100 machines means one machine doing 1,000 tests a day, which means 100 machines would do 1 lakh tests a day, right? So it's huge, and it's a very accurate test.
DST is also making a major headway when it comes to new kind of ventilators which are cheap as well as quite easily can be put in place.
And another way that we are fighting with the virus battle is activating our startup ecosystem. So we did a mapping of all the startups, some 700, which are in incubators supported by DST. And we found that nearly 100 of them actually have some very worthwhile product to offer in this. And about 50 of them are being funded because they have a product which is very advanced, which can be manufactured right away. So they are already connecting with the industry for manufacturing, and ventilators is one such item. There are other items, for example, disinfecting systems. What you need is for the entire hospital room, for the surfaces, not just for people, but for reusing PPEs and masks and everything. What one needs is very reliable disinfecting systems. They may be based on UV light, they are based on nanoparticles.
Which countries has come forward to have collaboration with India?
We already have a call out with USA because there's a very nice system we already have with USA working so that these proposals, which would be collaborative proposals, are being gathered, and within next 10 days or so that we would be able to fund these collaborative projects.
Well, appreciate your time. So that was Secretary DST telling us that it is a multidimensional problem, and to solve this problem, a multidimensional solution needs to be found for this in this regard. With the cameraman Smurti Ranjan, this is Taposh Bhattacharya, DD India, Delhi.
Moving on now, Prime Minister Narendra Modi on Wednesday greeted his Bangladeshi counterpart Sheikh Hasina on the occasion of the holy month of Ramadan and discussed with her the COVID-19 situation and how the two neighbors can collaborate in the fight against the deadly virus. In a tweet, Prime Minister Modi said, and I quote, "Spoke to Prime Minister Sheikh Hasina to greet her and the people of Bangladesh on the holy month of Ramadan. We discussed COVID-19 situation and the ways India and Bangladesh can collaborate in the fight against it. Our relationship with Bangladesh will continue to be one of our highest priorities," unquote. And the High Commission of India and Bangladesh said that the two leaders expressed happiness at the progress made in implementing the special arrangements agreed on the 15th of March between the leaders of the SAARC countries. Prime Minister Sheikh Hasina thanked Prime Minister Modi for taking the lead in coordinating efforts to combat COVID-19 in the region and for supplying medical aid to Bangladesh. And as the COVID-19 pandemic has brought the world to a standstill, people are finding different ways to prevent themselves from the virus. The Ayush Ministry has come up with self-care guidelines to boost immunity. Take a look at that, and of course the steps there for you. Drink warm water throughout the day. Daily practice of yoga asanas, especially pranayama and meditation for at least half an hour. Do take that time out for yourself and use spices like turmeric, curcumin, cumin, of course, coriander and garlic in cooking, believed to be the natural herbs, as it were, to boosting immunity inside us. So make sure you follow these steps and stay home, stay safe, stay protected. And we now take a look at some of the updates that inspire hope and positivity in tackling the COVID-19 outbreak. As a sign of respect for the corona warriors, the healthcare professionals, the Delhi police undertook a parikrama of the All India Institute of Medical Sciences, the AIIMS. At least 250 police personnel came on a scooty motorbike to salute all the doctors, the nurses, the paramedic staff and the cleaners, giving them all a huge respect that they also well deserve to the doctors' fraternity. The police personnel from South Delhi rode 51 COVID patrol bikes on the occasion to thank the healthcare professionals for their selfless service to the nation. So the police personnel, they're clearly taking the lead in demonstrating how we all need to be together and express gratitude for the great work that all the corona warriors in these challenging times are continuing to undertake. Moving on now, the economic activity has started in the country's first corona-free state, that's Goa, after getting relaxation in the lockdown from the Home Ministry. The Goa administration is making every effort to keep Goa COVID-free. Let's see a ground report from Goa.
People of Goa are relieved after getting extensions in lockdown after 21st April. Government offices have started opening, vegetables markets have opened, even shops have opened. And we can see in Goa that the people of Goa have started taking care of social distancing while shopping. And at the same time, the wheel of the economy, which has stopped due to this lockdown in the last 1 month, have started running. The district administration is also ready to help the migrant laborers who are trapped in Goa. Even some of the social organizations have come forward to help these needy migrant laborers. The biggest problem that the Goa government was facing was about the seafarers issue in Goa. But last night, there were around 3 buses which got around 65 numbers of Goan seafarers back to Goa from Bombay, and they will be quarantined in a hotel in Panjim for the next 14 days. Though at the moment Goa is COVID free, Goa government is not taking any chance and is in favor of extending the lockdown even after May 3rd. Kenzel Rodriguez, Panjim for DD India.
And let's now examine the facts behind some information floating around in the country during the COVID-19 pandemic. And the first, the Press Information Bureau fact check has busted a rumor on the news portal that claimed that in Jaipur, 300 people got infected by COVID-19 because of one sadhu smoking pipe. In fact, the office of the district magistrate Jaipur had informed that there was no such incident and the news is false. And let's now move on, scan through the developments from across the globe in World Wrap. Now, in the world's worst coronavirus hit, the US, the death toll has spiked to more than 60,875, while the number of cases of infection has also exceeded from 138,450 in the country. President Donald Trump has expressed confidence that the virus would be eradicated and the country was now equipped to put out the burning embers. And President Trump has said that he wants the U.S. Food and Drug Administration to help fast-track the use of a closely watched intravenous therapeutic drug currently undergoing trials for treating COVID-19 patients. When asked about the FDA to grant emergency use authorization for remdesivir, he said that the U.S. wants everything to be safe but would like to see very quick approvals, especially with things that work. The top U.S. infectious disease official said that the Gilead Sciences Inc.'s experimental antiviral drug, the remdesivir, will become the standard of care for COVID-19. The American physician and immunologist Dr. Anthony Stephens said that studies show that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery.
The data shows that remdesivir has a clear-cut, significant positive effect in diminishing the time to recovery. The time to recovery being shorter in the remdesivir arm, it was 11 days compared to 15 days.
And our correspondent Jagruti Dave has more details on the statement of Dr. Anthony, the director of the National Institute of Allergy and Infectious Diseases, on the drug remdesivir.
Early results from the clinical trial conducted by the National Institute of Allergies and Infectious Diseases showed that patients who had been given remdesivir recovered from COVID-19 31% faster than those who'd been given a placebo. The Institute's director, Dr. Anthony Fauci, who also sits on the government's coronavirus task force, said the findings were highly significant and said what is proven is that a drug can block the virus. Speaking earlier at the White House, Dr. Fauci said the antiviral drug made by the company Gilead Sciences will become the standard of care for COVID-19. However, he urged caution, saying that it wasn't a knockout for the virus. The effect of the drug on death rates is less clear, and the study conducted by the National Institute of Allergy and Infectious Diseases also still needs to be peer-reviewed. But in the absence of a proven drug against COVID-19, reports say the US's Food and Drug Administration is expected to authorize emergency use of remdesivir for patients who need it.
And talking about the COVID-19 cases in Spain, that has surged to more than 236,890, while the death toll in the country has also surpassed 24,270. The Spanish Prime Minister defended his government's management of the COVID-19 emergency in Parliament. He added that the government is planning a 4-phase de-escalation of the state of emergency from the country. Now, considering the critical situation going on across the world due to the COVID-19 pandemic, the Japanese Prime Minister Shinzo Abe has said that it will be impossible to host the Tokyo Olympic Games next year unless the COVID-19 pandemic is contained. The International Olympic Committee and the Japanese government postponed the Games last month until July 2021 because of the impact of the COVID-19 outbreak. Now, with the pandemic's worldwide infection rate climbing and experts suggesting a vaccine is still a long way off, questions are being asked about whether the huge set-piece event might need to be delayed any further. And with that, it's a wrap on our program tracking COVID-19. But news and updates will continue here on Doordarshan News and DD India. For the moment, thanks for being with us.
You're at the front line, battling the economy, battling the pandemic. We are here to support you as a public broadcaster of the world's largest democracy.
WHO that we are looking up to India because there's a whole history of India being able to eradicate diseases, whether it was smallpox, if you do remember, as well as polio.
The COVID has changed the contours of the globe, and post that, it's going to be a different world. But what is more important is that world will continue to look at India.
And India is among those countries, for sure. India acted very quickly. India, I think it was on the 6th of January that China actually declared that this was a virus from the corona strain, right? Or family. And on the 7th, already the Minister of Health was, convening people. And on the 17th, as you said yourself, I think he was already giving advisories.
Those countries that actually have been, ahead of the curve, taking the necessary measures to protect lives, are the ones where the eventual impact on the economy is also likely to be better. That's the rationale for the measures that we've actually adopted, starting with the lockdown on the 24th March.
India is at the war footing, though under lockdown mode, but dealing with it. And most importantly, the measures taken by our Prime Minister Narendra Modi were timely and decisive.
देखिए, मुझे दीनानाथ चतुर्वेदी से मिलना है। वो इसी धर्मशाला में काम करते हैं ना? ये मैं उनके लिए चिट्ठी लाया हूँ।